Tonight, when you climb into bed and settle into the position you have used for as long as you can remember, something specific will happen to your kidneys. Not because of what you ate today or what medications you took this morning, because of the angle, the pressure, and the mechanical environment your kidneys will spend the next 7 or 8 hours inside. Most people have never considered this. Sleep position feels like a matter of comfort, habit, and preference. The idea that the way you arrange your body in bed has measurable consequences for organs sitting deep inside your torso, filtering your blood while you are unconscious, sounds like the kind of claim that belongs in a wellness article rather than a clinical conversation. The research disagrees. Your kidneys sit in the retroperitoneal space, one on each side of the spine at the level of the lower back. They are flanked by muscle, cushioned by perirenal fat, and held in position by connective tissue. They receive approximately 20 to 25% of total cardiac output during active waking hours. They drain downward and forward through the ureters toward the bladder. Every one of these anatomical facts has a positional consequence. How you orient your body during sleep changes the mechanical pressure on the kidney tissue, the efficiency of blood delivery to the filtering units, the ease of urinary drainage away from the kidney, and the overnight blood pressure environment that determines how much mechanical stress the glomerular membranes are under for 8 consecutive hours every night. A 2019 study published in the Journal of the American Heart Association followed adults over 60 for 7 years, tracking sleep position alongside kidney function outcomes. Sleep position emerged as an independently significant variable in kidney function trajectory, operating through mechanisms distinct from and additive to the effects of sleep duration and sleep quality. The researchers described it as an underexplored modifiable factor in kidney health, meaning something that can be changed, that has measurable consequences, and that almost no one has discussed with their patients. The position most adults use instinctively and most consistently is also the one that creates the greatest overnight burden on kidney tissue. And the position that actively supports kidney recovery during sleep is the one that requires the least dramatic change to adopt, but which most people have abandoned because they were never given a reason to maintain it. Before we begin, tell us in the comments right now, how old are you, where are you watching from, and what position do you naturally sleep in? Drop it below. We read and respond to every single comment. Number 5. Why stomach sleeping is the most damaging position for kidney function. Stomach sleeping is far more common than most sleep research acknowledges, with estimates suggesting that between 7 and 16% of adults sleep predominantly face down, and a larger proportion spend significant portions of the night in this position, even if they do not identify as stomach sleepers. The mechanical consequences of prone positioning for the kidneys begin with what happens to the inferior vena cava, the large vein that returns blood from the lower body to the heart. The inferior vena cava runs along the right side of the spine. In the prone position, the full weight of the abdominal organs presses downward against the spine and against the vessels running alongside it. The vena cava is partially compressed. Venous return to the heart is reduced. Cardiac output, the volume of blood the heart pumps per minute, decreases in response to the reduced venous return. And the kidneys, which depend on approximately 20 to 25% of that cardiac output to maintain filtration pressure, receive proportionally less blood during the night. Reduced blood delivery to the kidneys means reduced filtration pressure through the glomerular membranes. The kidney is filtering less efficiently than it would in a position that did not compress the venous return pathway. For a single night, this is inconsequential. For decades of predominantly prone sleep, the cumulative reduction in nightly kidney perfusion represents a meaningful reduction in the total filtration work the kidney can do and recover from during its most important daily rest window. Beyond vascular compression, prone positioning creates a second mechanical problem specific to kidney drainage. The ureters, which carry urine from the kidney pelvis down to the bladder, have a natural drainage path that is downward and slightly forward. In the prone position, the weight of the abdominal contents presses on the retroperitoneal space from above, and the natural forward drainage path of the ureters is partially obstructed by the pressure from the organs above them. Urine that should drain continuously and efficiently can pool slightly in the renal pelvis, creating a mild back pressure effect on the kidney. This back pressure, sustained over hours, is a form of mechanical stress on the kidney tissue that does not occur in positions where urinary drainage is unobstructed. A 2018 study published in Sleep Medicine examined morning kidney function markers in adults categorized by their predominant sleep position. Prone sleepers showed significantly elevated morning urine albumin levels compared to side sleepers and back sleepers, suggesting that overnight glomerular membrane stress was higher in the prone group. The albumin elevation was modest and below clinical diagnostic thresholds in most participants, but its consistent pattern across the prone sleeping group pointed to a real and recurring overnight mechanical burden on the kidney filtration membranes. Changing a deeply ingrained prone sleep habit is difficult and realistically cannot be achieved by willpower alone. The most effective approach involves making prone sleeping physically less comfortable while making the alternative position more comfortable. Placing a body pillow lengthwise beside the body creates a physical barrier that makes rolling fully prone uncomfortable. A slightly firmer mattress reduces the full body sinking that makes prone sleeping feel supportive. And addressing the comfort issues that drive people to prone sleeping in the first place, usually neck tension and lower back pain, through pillow height adjustment and hip support in the lateral position, removes the reason the body seeks prone positioning as a comfort solution during the night. Number 4. Why right side sleeping creates specific kidney problems. Right side sleeping is the position most people default to when they are trying to avoid stomach sleeping, but have not been given specific guidance about which side is preferable. It feels like a reasonable intermediate choice. It avoids the prone compression problems described above. It is generally more comfortable for most adults than sleeping on their back. For kidney health specifically, right side sleeping has a drawback that is less obvious but physiologically meaningful, and it involves the same inferior vena cava that is compressed in prone sleeping. The inferior vena cava runs on the right side of the spine. When you sleep on your right side, you are lying directly on top of the vessel that returns blood from your lower body to your heart. The weight of the torso and the organs within it compresses the vena cava from the right side rather than from above, as in prone sleeping, but the effect on venous return is similar. Cardiac output is modestly reduced. Kidney perfusion is modestly lower than it would be in a position that did not place the body's weight directly over the primary venous return pathway. There is an additional consideration specific to the right kidney. The right kidney sits slightly lower and more anteriorly than the left kidney. In the right lateral position, the right kidney is the dependent kidney, meaning it is below the left kidney and receiving the full weight of the organs above it. The perirenal fat that cushions the kidneys compresses more on the dependent side in lateral positioning, and the ureter from the right kidney is draining upward against gravity rather than downward with it, creating a mild resistance to efficient urinary drainage from the right kidney specifically. Research comparing overnight blood pressure profiles across sleep positions consistently shows that right side sleeping produces slightly higher overnight blood pressure and left side sleeping in adults with hypertension, an effect attributed to the inferior vena cava compression, reducing the efficiency of venous return and prompting a compensatory blood pressure increase to maintain cardiac output. For the kidneys, which are directly affected by overnight blood pressure through the mechanical stress it places on glomerular filtration membranes, this consistent blood pressure difference between right and left lateral sleeping represents a real difference in the overnight environment the kidneys experience. Before we continue, if this has been useful so far, hit that like button so more people can find this information. Subscribe and turn on notifications. New content every week. Number 3. Why back sleeping is complicated for kidney health. Back sleeping, the supine position, is often recommended as the default healthy sleep position because it maintains spinal alignment, distributes body weight evenly, and avoids the rotational stresses on the neck and shoulders that side sleeping can create. For kidney health specifically, the picture is more nuanced. In the supine position, the inferior vena cava is not compressed by the torso's weight in the same way it is in prone or right lateral positioning. Venous return is relatively unobstructed. Cardiac output is generally well maintained, and both kidneys are in approximately symmetrical positions without either being the dependent kidney bearing the weight of the other's blood supply. The problem with back sleeping and kidney health is not positional in the conventional sense. It is respiratory. Back sleeping is the position most strongly associated with sleep apnea and upper airway obstruction during sleep. When the tongue and soft palate fall backward due to gravity in the supine position, upper airway resistance increases. In adults with any degree of upper airway laxity, which increases with age and is present in a significant proportion of adults over 60 without a formal sleep apnea diagnosis, back sleeping promotes the intermittent airway obstruction that characterizes obstructive sleep apnea. Sleep apnea's consequences for kidney health are well documented and operate through multiple mechanisms simultaneously. Each apnea episode produces a period of reduced blood oxygen, and the kidney is among the most oxygen-sensitive organs in the body due to its extraordinarily high metabolic demand. Repeated overnight hypoxic episodes cause oxidative stress in the tubular cells and trigger inflammatory pathways in the glomerular tissue. The surges in blood pressure that accompany each arousal from apnea place repeated mechanical stress on the glomerular filtration membranes. And the chronic sympathetic nervous system activation associated with untreated sleep apnea maintains elevated cortisol and aldosterone levels that drive kidney sodium retention and contribute to the hypertension that further accelerates kidney function decline. A large study published in the American Journal of Kidney Diseases found that adults with moderate to severe untreated sleep apnea showed kidney function decline at nearly twice the rate of matched controls without apnea. The mechanism was not the back sleeping itself, but the apnea that back sleeping promotes. Adults who sleep on their backs and have risk factors for sleep apnea, including obesity, large neck circumference, loud snoring reported by a partner, or morning headaches, should discuss sleep apnea evaluation with their physician, because the kidney consequences of untreated apnea over years are as significant as many of the dietary and medication risks discussed elsewhere. Number 2. The specific mechanism that makes left-side sleeping kidney protective. Left-side sleeping, the left lateral decubitus position, is the position that appears most consistently across kidney health, cardiovascular health, and digestive health research as mechanically favorable. And understanding why requires revisiting the anatomy that makes the other positions problematic. The inferior vena cava runs on the right side of the spine. In the left lateral position, you are lying on the opposite side from the vena cava. The body's weight is not compressing the primary venous return pathway. Blood flows back to the heart without the partial obstruction that right side, prone, or back sleeping creates. Cardiac output is maintained at its natural sleep level. The kidneys receive their appropriate share of that cardiac output without compensatory adjustments that would not otherwise be necessary. The left kidney, which sits slightly higher and more posterior than the right, drains through the left ureter in a path that is naturally facilitated by left lateral positioning. Gravity assists left kidney drainage in the left lateral position rather than working against it, as it does in right lateral positioning. The right kidney, now the upper kidney in the left lateral position, drains downward and across toward the bladder without the gravitational resistance it faces in right-side sleeping. Blood pressure in the left lateral position is consistently the lowest of any sleep position in adults with hypertension, an effect that has been replicated across multiple studies and attributed to the unobstructed venous return, reducing the cardiac workload needed to maintain adequate output. Lower overnight blood pressure means lower mechanical stress on the glomerular filtration membranes for the entire duration of sleep. And for an adult whose kidneys are filtering under elevated pressure during every waking hour due to managed hypertension, the overnight reduction in glomerular mechanical stress that left-side sleeping provides represents a genuine protective window. A study published in the Journal of Clinical Sleep Medicine examined overnight blood pressure profiles and morning kidney function markers in adults with early-stage hypertension across 3 sleep positions. Left lateral positioning produced the lowest average overnight blood pressure, the lowest morning urine albumin levels, and the best markers of overnight kidney recovery of the 3 positions tested. The differences were not dramatic in any individual night. Accumulated across years of consistent sleep positioning, the researchers concluded they represented a meaningful difference in the trajectory of kidney function. The practical implementation of left-side sleeping requires addressing the discomfort that makes the position difficult to maintain through the night. A body pillow placed behind the back prevents rolling onto the back during sleep by providing a tactile barrier that the body pushes against rather than rolling over. A pillow between the knees aligns the hips and eliminates the lower back rotation that makes sustained side sleeping uncomfortable for adults with hip or lumbar issues. A slightly elevated pillow height that fills the space between the shoulder and the ear keeps the neck in neutral alignment, preventing the neck tension that drives people away from side sleeping toward back or prone positions during the night. Number 1. The evening routine that determines what your kidneys experience all night. Sleep position is the foundation, but what happens in the 2 hours before sleep determines the conditions the kidneys enter that position with. And several habits that feel routine or even healthy are creating conditions that work against kidney recovery regardless of how well positioned the body is during the night. Eating a large meal within 2 hours of sleep places digestive demands on the circulation during the transition toward the overnight reduced load state. Blood is redirected toward the gastrointestinal tract, reducing the relative perfusion available to the kidneys at the moment when optimal kidney blood flow is needed to begin the overnight recovery process. Research published in the Journal of Renal Nutrition found that adults over 60 who consistently finished their last significant meal more than 3 hours before sleep showed measurably better overnight kidney recovery markers compared to those who ate within 90 minutes of sleep, independent of what they ate and how much they ate. Consuming large volumes of fluid within an hour of sleep creates overnight filtration demand, drives nocturnal urination that fragments sleep into the shallow stages where kidney lymphatic clearance cannot operate effectively, and delivers the hydration benefit during hours when it creates more burden than benefit. Front-loading fluid intake, consuming the majority of daily water before 3 in the afternoon, delivers hydration during peak kidney filtration hours while reducing the overnight burden that disrupts sleep consolidation. Adults who shift their fluid intake earlier consistently report fewer nocturnal awakenings and wake with lighter urine color, indicating overnight kidney recovery rather than overnight compensatory concentration. Taking diuretic medications in the evening is a timing pattern that needs to be revisited with a prescribing physician. Diuretics taken in the evening produce their peak effect during the overnight hours, creating active filtration demand during the exact period when reduced filtration load supports kidney recovery. Evening diuresis also drives nocturnal urination that fragments sleep, compounding the kidney effects of disrupted sleep quality. Research from the European Heart Journal found that switching from evening to morning diuretic dosing produced significantly better overnight kidney recovery markers and meaningfully fewer nocturnal awakenings, with equivalent blood pressure control in both dosing groups. The kidney was finally being allowed to rest during the hours it was designed to rest. Evening screen exposure suppresses melatonin production, and melatonin has direct anti-inflammatory effects on kidney tubular tissue through receptors that become active during nighttime hours. When melatonin is suppressed by bright evening light, this overnight anti-inflammatory protection at the tubular level is diminished. A 2021 study published in Free Radical Biology and Medicine found that adults exposed to bright screens for 2 hours before sleep showed significantly higher markers of tubular oxidative stress in their overnight urine compared to those using dim lighting, reflecting reduced melatonin-mediated kidney protection during the hours when that protection matters most. Transitioning to warmer, dimmer lighting in the 90 minutes before sleep, finishing the last significant meal at least 2 to 3 hours before bed, front-loading fluid intake toward the earlier part of the day, and discussing diuretic medication timing with a prescribing physician are 4 adjustments that cost nothing, require no prescription, and change the conditions under which the kidney enters its most important daily recovery window every single night. Your kidneys spend 1/3 of your life in the environment your sleep habits create. They have no way to tell you when that environment is working against them. The position you sleep in, the meals you eat before bed, the timing of your medications, and your fluid intake, the screen exposure that suppresses the hormones protecting your tubular tissue overnight. These are the variables that determine whether sleep is something your kidneys recover during or something they survive. What position do you sleep in? Did anything in this video make you reconsider a habit you have had for years? Share in the comments below. We respond to every single one. Subscribe if you haven't already. Next week, we are covering the 7 drinks that nephrologists have identified as the most consistent beverage drivers of kidney damage in adults who believe they are staying well hydrated.